Now we want to get a status report on Omicron from a medical expert who can tell us what we can do to avoid it and what to do if we get it. We are joined by Dr. Geeta Nayyar, an associate professor at the University of Miami Medical School and a specialist in autoimmune chronic diseases. Dr. G, good morning. Great to see you. How are you?
Good morning. Doing well. Happy New Year, Michael. Thanks for having me on.
Well, we are delighted you are here. Well, we just heard Trent Kelly there at a site. We know tens of thousands of people are going to these test sites, and then others are getting these home testing kits. And a lot of these people, 26%, are testing positive, and I suspect, I don't know that they're freaking out, but they're certainly anxious. How anxious should they be?
Well, here's the reality. This is not the time to freak out. It is time for us to all get a grip and realize that this virus is here to stay. If you're thinking about your New Year's resolution, that one of the things that should be top of your list is having a relationship with the doctor that you can ask questions to. This will help reduce panic and help you stay really, really informed and not get lost in the shuffle.
Yeah. We have seen, and perhaps in interviews with you and other expert physicians this week, that the Omicron variant is milder, but that really, it's a relative term. I mean, we know that Delta went down into people's lungs and made them extremely ill, killed over 800,000 people in this country. What is different about Omicron?
So the thing that's most different about this is, number one, it is more contagious. It's spreading very quickly because of the mutations that we found in Omicron. It is really spreading very quickly. 70% more contagious than the Delta variant. So what this means to you is that you've got to remember that this is a marathon. This is a sprint. It is not going away anytime soon. That is why vaccinating, boosting, wearing masks, socially distancing, if you are indoors, ventilating the area that you're in, are really key and foremost as you think about going anywhere, including going back to school this January.
Yeah, good advice. Well, I know that you, Dr. G, have rules to live by, Dr. G's rules to live by. And the first one says just avoid anybody who is unvaccinated. But how do you know if they're vaccinated or not?
So you don't, right? So the number one thing you have to do, Michael, is number one, assess the medical risk of your own household. Understanding who in your family is most at risk, most vulnerable, whether that's an elderly individual, someone who's immunocompromised, a young child who's unvaccinated. That's really the number one thing that you have to keep in mind when you're making decisions of whether to go somewhere or not. Just like we all have different financial health, we all have different medical health. Number two is you are going somewhere public. You have to assume, and that could be the grocery store, that could be your local CVS, your local Target. You have to assume at this point, with community spread the way it is, that the person next to you is not vaccinated and has Omicron. So you need to adjust your behaviors accordingly, which means wearing the correct fitting mask, an N95 ideally, keeping your distance, washing your hands, and getting in and getting out. Look, exposure risk is cumulative. The more time you spend in a public setting with individuals who could have this virus or who are not vaccinated, it increases your risk for yourself. And again, keeping in mind who you're coming home to is really going to be very important as you think about the risk benefit of partaking in certain activities.
Yeah. Dr. G, we have just come through the Christmas holiday season. Families got together. There have been big parties. And Friday night in the Orange Bowl, more than 50,000 people were there close together for the Orange Bowl game. And you look at these things like that football game and you say, is this a super spreader event? Because then we later learned that the University of Georgia marching band that was playing there, that 60 of their members then tested positive for COVID. So does it make sense to even take part in events like that?
So again, we have to get grips that this virus isn't going away. We have to start living with it, which means using the tools at our disposal. And remember, testing helps us prevent spread because we know our status in a moment of time, just like a picture as opposed to a movie. But being vaccinated and boosted prevents severe illness and hospitalization. So the number one thing you and your family need to do is to get vaccinated, get boosted, wear your mask, Get tested so you know who to mix with and who not to mix with. But this is the new future, Michael. And what we have to remember, the silver lining here, is we have made progress. We have saved millions of lives with vaccinations and boosters. We've got to double down, move forward, and continue to live our life and taking as much risk out of it as we can.
Yeah. Dr. G, we know that a lot of people who are testing positive are not seriously ill, but they may want to go to an emergency room. Now, you're a physician. What would be your advice to somebody who's positive but is basically asymptomatic? They should not go to an emergency room?
So this is why it's so important to have a physician, a medical professional that you trust, that you can call, even if that's on a virtual visit. Telemedicine is now available more generally, but making sure you have a doctor you can talk to before going to the emergency room. The emergency room is for emergencies. If you're having difficulty breathing, you are bleeding, you've had a fracture, this is where you go to the emergency room. But right now, our hospital capacity is of concern. We're concerned as we see cases going up. And so that's why having a doctor, making that decision with them, staying in the home, taking advantage of tools and medications that we can use in the home to get through the hump when you have a less severe case, which we're finding is the majority of cases.
One of your rules to live by says avoid planes, trains, and cruise ships. As you obviously are aware, the CDC late this week advised Americans, people everywhere in fact, not to go on a cruise even if you are fully vaccinated. Do you agree with that?
So I do agree with that. The issue with cruises is that they're very close quarters. And again, if you are in the public, you are surrounded by individuals that you don't know their vaccination status, you have to assume they have Omicron. It is difficult to wear a mask the entire time on a cruise. Close quarters make it difficult to socially distance. And you and I both know there's a lot of eating and drinking on cruises. So masks come off, and then you essentially are in a closed, tight environment, and individuals are really stuck on the boat. With regards to general transportation and travel, again, it comes back to that assessment of the medical risk in your household and really the airport. The airport is the place that is more dangerous than even the plane. And that's why you have to remember, if you are standing next to someone and you don't know them, you must assume that they are carrying the virus and they have not been vaccinated, which means your mask should not come off and you need to keep your distance. And that just becomes hard depending how long your journey is. You also have to eat and drink. So being mindful of that, if you are traveling, trying to do that before or after you enter the airport is going to be ideal, but really making sure that mask is on tight and ensuring that you're doing everything you can to prevent this. Because if your mask comes off with the R naught on this virus, it is incredibly contagious and you have to assume that you're at risk.
Yeah. Dr. Geeta Nayyar, great advice. Thank you very much and be well yourself.
Thank you.